Hi guys, so today I'm having my port fitted, which is actually called an implanted venous access device. I'm hoping that I can record everything today for you guys, so let's go. So the next video is me showing you what the actual port looks like when they insert it inside of you. This next video is the video that they show you the whole process of what is actually going to happen when they put the port inside of you.
Device insertion, also known as an IVAD insertion. An IVAD is a small device placed beneath the skin of your chest and under your collarbone, which then connects to a soft, small tube called catheter. The catheter will be placed inside one of your large central veins that takes blood to your heart. Each time you receive chemo, a special needle will be inserted through your skin to access this port. Behind this door is our fluoroscopy room. This is where your procedure will take place today. In this room, you'll be cared for by our healthcare team consisting of a nurse, an X-ray technologist, and a radiologist who will be performing your procedure. Please remember to refrain from touching anything in the room unless directed by staff. This is for your safety. Once you've entered the room, you'll be asked to lay down on the procedure table. A cushion will be placed under your legs to ensure you are comfortable. The X-ray technologist will then place a blood pressure cuff on your arm, an oxygen sensor on your finger, and sensors on your chest to monitor you during the procedure. Your skin will then be cleaned with an antibacterial soap to ensure sterility of the insertion site. Once cleaned, sterile drapes will be placed over your body. For a brief moment, these drapes will cover your face. Please keep your arms by your side and refrain from touching these drapes. If you feel the need to move your body at this point, please ask for assistance. This includes adjusting your mask, scratching your nose, or repositioning your legs. Your skin will be frozen with a local anesthetic. You may feel some burning or stinging when the freezing goes in. However, it should work within seconds to numb your skin. If you feel any sharp sensations after the freezing, please make the team aware. During the procedure, 2 small incisions will be made. There will be 1 small incision made to the right of your neck and 1 incision on your upper right chest. The doctor will use an ultrasound probe to find the required vein in your neck. This is where the first incision is made. Next, the doctor will put freezing into the skin on your chest, just below your collarbone, where the pocket is made for your port. A tunnel is then made under the skin on your chest between the 2 incisions. The catheter is then pulled through the tunnel and placed into a vein that leads down to your heart. An X-ray is now taken to make sure the line is the correct length. Once the line is in, the doctor will put X-ray dye into the line to ensure it is in the correct place and working well. The doctor then uses stitches under the skin to close the incision on your chest, followed by staples to close the top layer of your skin. The stitches dissolve on their own, but the staples will need to be removed after 8 to 10 days. The incision on your neck is closed with an adhesive tape called steri strips. Because the port is placed under the skin, it must be accessed using a special needle when IV therapy is required. Prior to the access, the skin is thoroughly cleaned with antiseptic. The needle is then inserted through your skin under the rubber top of the port. Because the needle is going through your skin, you might feel a slight poke. If required, local anesthetic creams can be applied 1 hour prior to numb the site. The needle is attached to a short length of tubing that hangs down the front of your chest. A small dressing is used to cover and protect that needle. The fluid or medicine flows through the needle and into the port, then through the catheter and into the bloodstream. Following treatment completion, the needle is removed. Each time a nurse accesses your port, they will check to make sure that they can get blood back through the tubing. Once healed, your port may look like this.
Although insertion of a venous catheter is usually uneventful and risks are very low, whether it be an implanted vascular access device, also known as an IVAD, central venous catheter, also known as a CVC, or a peripherally inserted central catheter, also known as a PIC, a number of potential complications exist that you ought to be aware of. The first is bleeding. This catheter insertion procedure is at a very low risk for significant bleeding. However, if you do notice swelling at the sites of the small incisions, then applying firm pressure will likely be sufficient to stop this swelling from worsening. If swelling continues to worsen, or if you have concerns about this swelling, then you are encouraged to contact the triage number provided to you. A second potential complication is infection. Precautions are taken to significantly reduce the number of insertion-related infections that occur. However, if you notice redness, warmth, or excessive tenderness around the catheter exit site or around the incisions in the case of the IVAD, then this could indicate the presence of a skin infection. If you develop a fever, chills, or aching working muscles anytime after the first couple of days following catheter insertion, then this could indicate that the catheter is infected and that this has spread to the bloodstream. If any of these signs or symptoms have developed, then it is important that you call the triage number provided to you for further advice. A third potential complication is clotting. These indwelling catheters are foreign bodies, and they can occasionally become blocked by a blood clot. Catheter blockages do not usually cause symptoms, although swelling of the neck, face, or arms can occur on occasion. The blockage of a catheter, if it does occur, will typically be first discovered by your nurse when she or he next tries to flush the catheter with saline. If the catheter is blocked, then your nurse will attempt to reopen the catheter with a medication that dissolves the clot. If the catheter will not reopen, then it may require removal. The catheter may also require removal if you develop swelling of the neck, face, or arms. Other potential complications exist which may require catheter removal. These are rare events and include such things as flipping of the catheter into a different blood vessel, irritation of the heart, which can cause the heart to beat more quickly or firmly, rotation of the reservoir under the skin in the case of the IVAD, and partial withdrawal of the catheter in the cases of the CVC and PIC. This complication list is not intended to be comprehensive. Other very rare complications have been reported during CVC and IVAD insertions, such as arterial injury, nerve injury, injury to the top of the lung, which potentially causes a partial collapse, and bleeding into the chest cavity. These are considered rare with an incidence of less than 1 in 1,000 insertions, but these can be managed. To summarize, a number of potential complications exist. However, the insertion of venous access catheters, whether it be an IVAD, CVC, or PIC, is usually uneventful, and these catheters usually function well for those patients who require them for intravenous treatments. If you have additional questions about complications related to the catheter insertion, then feel free to discuss these with your nurse or with the radiologist.
Following completion of your procedure today, you'll be escorted in a wheelchair to recover in the surgical daycare unit for approximately 1 hour. Information will be given to you regarding how to take care of your catheter. This includes when you can shower, how to clean the insertion site on your chest, and other important instructions that are vital for you to follow. If you have any further questions, the nurses in the surgical daycare unit will be happy to answer them for you. You will now be asked to sign a consent form to proceed with the procedure today.
This next video is a video of the nurse telling me how to actually clean and care for it over the next 8 days.
Take that top dressing off, you're going to throw it away. It's a little bit smaller than this one, and it's quite a bit closer on you. This guy is not completely anatomically correct. So you have a swab. You're going to take your first swab. It opens up like this. Yours will be really wet and white. Mine is old and has been used quite a few times. So yours is white and juicy. When you go to clean it, you're just going to do a nice up and down or back and forth friction motion right over top of all those steri strips. Okay? This line that I'm going over down here, this is under your skin and you won't feel it. Okay?
So I need to apply a little bit of pressure on there or not, or just gentle?
A little bit. You'll be gentle, but enough friction that you can feel that it's moving.
Okay.
Okay. So then you've gone over top of it, and the incision's kind of under those steri strips. Now you just let it dry, and you throw this swab in the garbage.
So I'm not taking the steri strips off, or I am?
You're not. You're going to go right over top of them. So you're just going to go that up and down, just kind of right over top of them.
Okay.
And they're kind of moving even on this guy. They might move on you a little bit, and that's okay.
Okay.
Just let it dry now without fanning or blowing on it.
Okay.
And once it's dry, no more dressing. Leave the steri strips on. They're going to start kind of peeling up and falling off over time, and that's fine.
Okay.
If they're still on by the time you take your staples out in 8 to 10 days, just peel them off. It's not a big deal.
Okay.
But you don't have to cover it again. You don't have to clean it again. You just get to leave it.
Okay.
Okay. Then you're going to take your new swab and you're going to remove this old dressing here. It's going to come off a lot easier on you, but our mannequin.
So we're going to keep that dressing on until we've cleaned that dressing.
It kind of just that way, it's a good mental reminder to get a new swab.
Yes.
So when you take it off, you will not see the IVAD.
Obviously.
You will just see the bump.
Yes.
You'd be surprised how many people ask. Seriously. And I get it. It doesn't, right? So this is the IVAD here. This will be like a little bit of a bump. They look like tiny little pacemakers. There might be some extra gauze. Throw it out and don't worry about putting on any new gauze. You will just be putting on a new dressing.
Yes.
So with your swab, this is where you're giving that good inspection. Okay, it might be red, it might be swollen kind of around here. It just got put in. that's okay.
Okay.
This is where you want to take a good look so that you know the next time you change it if it's changed or not for the better, because you want to see the redness going down, the swelling going down. You want to see it kind of seal up right on that incision line there.
Right.
Okay, so we're going to do the same idea. On the top, I said you could go back and forth this way. On the bottom, I wouldn't recommend it. You might just catch a staple and
yes, I don't want to do that.
No. So you're with your clean swab. I'm just going to go up and down. And you have skin, so it's a little bit easier. And again, you're only applying as much pressure that is comfortable. Like, you're touching your skin with the swab and giving it a good amount. Like, the pressure, you're not going to go barely, but not so much that you're hurting yourself.
Yes.
Okay. You can flip over in your swab because maybe there's some old blood there. You're going to just kind of give it another one. And then you can let it dry. Again, you'll throw this out, and again, you're not going to be fanning on it. You're not going to be blowing on it. You're just going to kind of let it be. If you accidentally put your dressing on a little bit too soon, you just run the risk of getting an uncomfortable rash.
Okay.
Which actually many people will kind of sometimes think is an allergy, but it's just because the chlorhexidine hasn't completely dried. You're going to take a new dressing out of your bag, and they open exactly like a Band-Aid. They'll have two little pieces here, and they just kind of pull back like that. And you don't have to cover the big part as much. We're not really as concerned about that. So if you have to put it down and some of the bump is sticking out, that's okay. We basically just want those staples covered.
Gotcha.
And then you're going to put it on, and that is actually the extent of your dressing changes. So for the first time, take this off, clean it, don't put anything on. Move down to this one, take it off, clean it, put a new dressing on.
How many dressing changes did you say there were?
There are 5 in here. So that should take you to 10 days if you... Because you can have the staples removed at 8 days if you want. So you might end up with an extra. If you end up with an extra, it's not the end of the world.
Okay.
Okay? So every time you change it after this, every 2 days, this is the process you're going to repeat. You don't have to pay attention to that. You're
So it's every 2 days, not every day. Okay.
Every 2 days, unless you get it wet. So say you had a shower and you accidentally didn't tape it up quite enough and a little bit of water got in. You're going to change it right away, and you're going to restart your 2 days from that day.
Because you're worried about infection.
Exactly.
Yeah.
You don't want anything warm and wet sitting on there.
Awesome.
Yeah. And that's kind of the extent of it. So, any questions or concerns about those dressing changes?
No. This headscarf's kind of on different. Okay, so this is what it looks like so far. I won't be able to show you what it looks like because it's going to look a bit bloody if I show you without the bandages later on. But that's kind of like where they positioned it. I didn't feel any pain at all when they were doing it. I did get a little bit, I don't know, clammy and nervous when they were. It's just an odd feeling of somebody just putting something inside of you. You can't feel like them cutting you because they numb it really well. And it's just them like putting the tube, I think they cut at the top part here, and then they insert like the drain down or something. I'm not quite sure how it was going on, but it was kind of like just a weird sensation of them putting something inside of you. Doesn't hurt, nothing. Hope you found that video somewhat informative. I'm hoping it's going to make my next chemo go easier. I'm going to be able to have my staples taken out at my next chemo, so, and hopefully everything's all healed up and I'll be able to show you what it looks like when I have all this stuff removed. So thank you very much for watching. Bye guys.